Good morning, everyone. I am Dr. Indrajit Banerjee. I am working as an associate professor in the Department of Pharmacology at Mauritius. Today, on the behalf of my research team, I will be presenting a paper, Educational and Psychological Impact of COVID-19 and Lockdown among University medical students in Mauritius. The novel coronavirus or COVID-19, which was surfaced in Wuhan in 2019, subsequently led to a pandemic. And by March 11, 2020, it has gained a status of pandemic by WHO. To avoid the exposure and viral transmission, it has resulted into the closure of universities. For most of the medical students, clinical placement stopped and healthcare setting focused on care of patients with COVID-19. Teaching in classrooms and laboratories were also cancelled, leaving the students to continue to their studies remotely. Harris et al. From a study from USA has found that 75% of the students agreed the pandemic has significantly disrupted their medical education. But the limitation of this study was the response rate was only 29.5%. The primary objective of our study was to find out the educational and psychological impact of lockdown on medical students due to COVID-19. This is the first study that is reported from the country Mauritius. Coming to the methodology of the study, a cross-sectional study was performed and the data was collected from 30th May to 8 June 2020. A total of 663 students from 1st to 10th semester currently studying medicine were participated in the study. This is the country Mauritius that is present in the Indian Ocean and it is near to Madagascar and South Africa. For data collection, we have used the Google form, and for questionnaire designing, we have used a 5-point Likert scale for measuring the psychological and educational impact on medical students. A scoring scale was used. A total score of 40 was used for psychological impact, which was having 8 items. And for educational impact, there was our 7th statement and total score was 35. A total score of 20 and above for psychological impact was considered to have psychological impact due to COVID-19, and total score of 18 or above was considered to have educational impact on medical students. For questionnaire validity, 5 subject experts were there. They have validated the questionnaire. For face validity, a pilot study was done among 10 medical students for the readability of the questionnaire. Reliability analysis, we have used Cronbach alpha. It was found to have 0.721 for psychological domain and 0.685 for the educational domain. The total Cronbach alpha score was 0.717 for the 15 items total. For inclusion criteria, a total of 700 students included in the study, out of which 663 participated in the study. For exclusion, those who have not given their consent and those who are not willing to participate into the study, they were excluded from the study. Prior to the study, we have taken the ethical clearance from the Institutional Review Board and a sample size calculation was done and we have reached adequate sample size of 663. For data management and statistical analysis, we have used SPSS version 24 software. The results were quite interesting. Out of 700 students, 663 students participated in the study, which gives a response rate of 95%. This is a table 1, which shows out of all students, the psychological impact was present in about 70% of the students. And educational impact was present in 95.6% of medical students. This is a table 2 which is showing a correlation between the demographic and the psychological impact. Out of all the students which are having poor net connectivity, 77.8% of the students were having psychological impact. And out of all the students, those who were using smartphones 6 to 8 hours per day, its psychological impact was present in 77.8% of the students. For educational impact, among all the Indian students, 97.4% of the students were having educational impact. 92.5% of all Mauritian students were having education impact. About all South African students, about 89.7% of the students were having education impact. Among all the students, those who are having smartphone addiction for more than 4 to 6 hours, 98.2% of the students were having educational impact. Among all the students, those who are using smartphone 6 to 8 hourly, 96.2% of the students were having educational impact. This is a logistic regression table which is showing that the clinical students were having 1.219 times more of having educational impact as compared to preclinical students. And the Mauritian students were having 4.2936% times more of having educational impact as compared to other nationalities. And those who were at hometown, they were having more educational impact, 2.464 times more as compared to students those who were away from the home. For the psychological impact, the preclinical students were having 1.13 times more of having psychological impact than clinical students. This is the image which is showing the impact of COVID-19 due to education. You can see here 38.9% of the students were not able to adapt with the new method of teaching. And this is for the psychological. 36.3% of the students were having feeling of guilt. They have agreed with the statement. And 27.9% were having neutral response for having depression. Coming to the strengths, data was collected when Mauritius was experiencing their first wave, and the response rate of our study was 95%. The depression anxiety scale 21, that scale was not used to measure the psychological impact. This was our limitation. To conclude, lockdown triggered both educational and psychological impact on medical students. These are my references, and thank you very much.